Good evening. How are you doing today?
All right.
My name is Jennifer. I'm going to be your nurse today. Could you tell me your first and last name and your birthday, please?
Crystal Lafferty, 3579.
All right. What brings you in today?
Oh, just a regular checkup.
Okay. Is there any kind of health history that I need to know about?
I've had several surgeries. I've had a breast reduction, abdominoplasty, gastric sleeve. I've had my tonsils removed, and my gallbladder and my appendix removed.
Okay, very good. Your general appearance looks good. I see 3 coats laying over there. You must be cold. You must not be a fan of the snow.
No.
Well, I guess I should say hoodie and 2 coats. All right, honey. If you don't care, I'm going to check out your scalp real quick.
Okay.
Those are regular. Are these readers or just regular glasses?
Those are my regular glasses.
Okay, I'm going to lay them on the table here if you don't care.
Okay.
All right, we're just checking for bumps and lesions and infestations, and I'm going to palpate around. You tell me if you have any pain or tenderness. Okay, have you had any headaches, anything going on with your head lately?
No.
Okay, good. Your hair's good and shiny and looks like it's full in this ponytail. All right, we're going to do 2 different things here real quick. I need you to close your eyes for me. I'm going to put something under your nose for you to smell. I want you to tell me what it is, okay? All right.
Alcohol.
Very good. And then I'm going to touch your face with something while you still have your eyes closed, and I want you to point to where you felt it, okay?
Okay. There.
Very good. Ready?
Mm-hmm. There.
Very good. Okay, can you smile for me? Can you wrinkle your forehead? Can you stick your tongue out? Put your tongue in each cheek like that. Yep, very good. All right, I'm just going to look at your face. Your eyes are symmetrical. Your nose is midline on your face. Your lips, you got some bright red lipstick on. Does your mom like that?
No.
I didn't think so. Most people's moms don't like that. All right. I'm going to palpate your temporal arteries. Everything feels good there. I'm going to just come on down and check your lymph nodes out. I want you to tell me if you have any pain or tenderness. I'm feeling for swelling, and I need you to tell me if it hurts at all, okay?
Okay.
Anything there?
No.
Good. This is your post-auricular. Those were your pre. Anything there?
No.
Okay. Occipital.
No.
Submandibular.
No.
Submental.
No.
Supraclavicular.
No.
No pain?
No.
Very good. All right. I'm going to check your sinuses. You tell me if you have any pain or tenderness. Anything?
No.
Anything?
No.
Anything?
No.
Anything?
No. No.
Good. If you could look up for me. See that your trachea is midline. There's no edema. You have any problems swallowing?
No.
Okay, very good. All right. I'm going to push down on your shoulders. I want you to push back against me. Good. One more time. Good. All right. We'll just do a little range of motion with your neck. If you could look up, down, right, left, and do a big circle. All right. I didn't hear any popping or cracking. Did you have any pain or anything going on there?
No.
All right. So we're going to check your eyes first. Yeah. And so you do wear corrective lenses, right?
Yeah.
And that's what we have over there. So, all right. I'm just going to look at the outside real quick. There's no periorbital edema, no redness. If you could open your eyes. Your conjunctiva looks good. There's no jaundice or redness to your sclera. Very good. All right, I want to take my light, and I want you to look straight at my light. I'm just checking for reaction and accommodation, okay?
Mm-hmm.
Ready?
Yep.
Very good. And again. Very good. All right, if you could follow the end of my light, I'm not going to have it turned on, but I want you to just follow the end of it, okay?
Okay.
Don't move your head, just your eyes. Good. Good. Very good. All right. Now I'm going to get eye level with you. I want you to tell me when you see my finger in your peripheral vision.
Okay. No.
Good. Same thing?
No.
Awesome. All right. I'm going to give you a piece of paper. I want you to cover your right eye and read the first line.
Okay.
Then cover your left eye, read the second line, and hold it about 6 inches from your face.
Okay.
About 6 inches.
Mental status assessment begins during the health history. How the patient responds to your questions gives clues to their orientation and memory.
Very good. All right, if you could stand up. Do you know what a Snellen chart is?
Yes.
Okay. First, I want you to stand with your feet together for me. Arms to your side. Look straight ahead. Okay, close your eyes. I'm watching for swaying or movement. Do you feel any?
No.
Everything looked good to me. All right, if you could walk to that line, and I want you to walk heel to toe.
Okay.
So I can check your balance. Very good. All right, I've got my chart up here. If you could read for me the first line that you can see well, with one eye covered.
PECFD.
Very good. And the other eye?
PECFD.
Awesome. Looks good. All right, you can come back on over and have a seat. All right, we'll check your nose out. Have you had any issues, any colds or infections or anything going on lately?
No.
All right, could you cover one nostril? Inhale and exhale. Good. Cover the other nostril. Same thing. Very good. And you already smelled the alcohol for me, so that was good. I'm just going to take a look at it. Have you ever had your nose broken?
No.
All right, everything's good and straight midline. There's no deviation of your septum. I'm going to look at them here and check your membranes, okay?
Mm-hmm.
Good. Everything's pink, moist, just like we like it. I don't see any drainage, any issues, right?
No.
All right, let's check out your mouth. Your lips look good. Oral mucosa looks good. There's no missing teeth. Your tongue's nice and pink. I see your tonsils back there. Could you say off for me? Good. Your uvula goes up and down. And your soft palate looks great. All right, we're going to check your gag reflex now. Okay, you ready? Good job. I have a cup of water. I just want to watch you swallow. If you don't mind, take a drink for me. Good. All right. We'll take a look at your ears real quick, okay?
Okay.
All right. I'm just checking the outside for any kind of swelling or redness. I see your lobes are pierced on both sides and a cartilage on this side. Got any issues with your ears?
No.
Any issues with your hearing?
No.
All right. Now I'm going to grab the pin of your ear, which is this area up here, and I'm going to pull it up and back, and I'm going to check down your ear canal and your eardrum, okay?
Mm-hmm.
There we go. Good. There's no redness, no earwax, and your eardrum's a pearly gray color. If you could check this side. Up and back. And there's no redness, no wax, and your eardrum is pearly gray, just like we like it. Very good. All right. Now I'm going to whisper something in each ear, just a word, and I want you to tell me what that word was, okay?
Okay. Grapes.
I like grapes.
Cool Whip.
Grapes and Cool Whip. That's a good combo. All right. I'm going to grab my stethoscope, and I'm going to come behind you and just check out your lungs and the expansion of your back and such, okay?
Okay.
All right. If you could lean forward and take deep breaths. What I'm doing is making sure that you're expanding. Your lungs are expanding equally as we go down, okay? Go ahead. Good. And again. And again. Good. Any pain or tenderness?
No.
I'm going to push down through here. Then I'm going to go down your spine. Tell me if there's any pain or tenderness. Do you have a history of scoliosis?
No.
Your spine's good midline. Does it hurt at all?
No.
Okay. And this, where your ribs meet at the vertebral angle is very good. Do you have any pain or tenderness there?
No.
Very good. Okay. Do you have any lesions, bumps, moles, or any kind of weird stuff that you want me to inspect on your back?
No.
Okay. Very good. I'm going to listen to your lungs. Just take a deep breath in and out for me.
Okay.
Good. Your right upper lobe sounds good. Left upper lobe sounds good. Left lower lobe sounds good. Right lower lobe sounds good. I'm going to do the same thing on the front, okay?
Okay.
deep breath. Very good. Same thing. Good. Good. Very nice. All right. Well, I've got my stethoscope out. I'm going to go ahead and take a listen to your heart. Have you had any issues with your heart?
No.
I'm going to feel for what's called the PMI. It's the point of maximal impulse. It's where I can feel your heartbeat best at. Nope. Good. All right. Now I'm going to listen for different areas of your heart, okay?
Okay.
And just take a second. This is aortic, pulmonic, tricuspid, and mitral. Very good. There's S1 and S2 sounds are pronounced. That's the lub dub that you hear on your heartbeat. Lub
Yes.
dub, lub dub. So there's no issues there. There were no S3 or S4 sounds, which means no extra heartbeats or skipped heartbeats or irregular rhythms or gallops or anything of the sort. Okay.
Okay.
All right. Let me see your nails for just a second. So I'm just checking for any kind of clubbing or anything going on with your fingernails. Your cap refill time. Good. It's less than 2 seconds. Consistency's good. There's no clubbing. The color's consistent with all the skin on the rest of your body, so that's very good. Do you drink enough water?
I'd say so.
Okay. I'm just going to do a skin trigger test, and that's one way to check for dehydration. Okay.
Okay.
Oh, very good. We'll check it here. Also very good. All right. While we're here, let me go ahead and check your pulses. Okay.
All right.
Good, strong. I'm going to check them in each place. Good. They're what we call a +2, which means they're good and firm, but not, they're not overly boundy. Okay. If you would ever need to, you can check for a pulse in your femoral area right here.
Okay.
We don't have a need to do that today, but just so you know, it's there. If you don't care to remove your shoes for me, and put both your feet up here on my legs. Good. All right. Post-tibial pulses are good. Dorsalis pedis is good. Your legs are nice and symmetrical. There's no issues there. Popliteal pulses are good. All right, you can relax there for just a second. Okay, so you go to the gynecologist regularly?
Yearly.
Yearly? Do you have a mammogram?
Yearly also.
Okay. Have you ever had any issues or anything?
No.
Okay. Do you do monthly self-breast exams?
Yes.
What time do you do those?
At the same time every month after my period.
Okay. And if you don't care to lay down, we're just going to practice one because it's very important. I want to make sure that you're doing it the right way. Okay. If you can take one arm and put it over and behind your head. Okay. Take your other hand, reach into your arm. Start feeling around. You're pushing hard. You want to see if there's any bumps, nodules, any pain, tenderness, anything like that. Okay. And then walk your fingers over to your breast. And then laterally up and down. And cover your entire breast, pushing good and firm. Make sure that there's no nodules or any kind of bumps in there, okay?
Okay.
Make sure you cover your entire breast. All the way across. Good job. And then, of course, you repeat on your other breast, okay?
Okay.
So while you're laying down there, if you don't care, I'm going to go ahead and take a look at your abdomen for you.
All right.
All right. Do you mind if I pull your shirt up? Good. So you said you had several surgeries. I see a scar from here to here. Is this from your abdominoplasty?
Yes.
And some laparoscopic incisions. I'm assuming those are your gallbladder and your appendix?
Yes.
Okay. And you had a sleeve surgery too, right?
Correct.
Okay, very good. So your skin looks good. With those scars, the contour is good. Symmetry is good. If you don't care, I'm going to listen for your bowel sounds. I bet with that sleeve surgery, you usually have pretty active sounding bowel sounds.
Yes.
Good. I'm going to check all 4 quadrants. Good. 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 Did you have dinner before you came in?
No, I'm hungry though.
That's probably what we're hearing. All right, I'm just going to percuss on here a little bit on all 4 quadrants, okay? Any tenderness?
No.
Okay. We'll lightly palpate. Make sure we don't feel anything. Since you don't have an appendix, you're not going to have any rebound tenderness, which is something that we generally look for. But since your appendix is gone, that's not going to happen. I'm going to palpate deeper this time, okay? Everything good there?
Yeah.
All right, very good. And if you want to set up, you need some help?
No.
Okay. All right, I'm going to give you 4 words, and I need you to remember those 4 words for me, okay? They are blue, tree, car, horse. You got those?
Blue tree, car, horse.
All right. If you can throw your legs back up here for me. So we already checked, made sure everything was good and straight. What's up, son? Look at your legs. Good. Looks like you recently shaved. There's no hair. When it does grow, does it grow evenly?
Yes.
Just normal dark hair or blonde?
Blonde.
Okay. So no issues there, just normal.
Mm-hmm.
All right. Symmetry's good. Your skin looks good. The hair. Can you take this toe, point it up towards me? Good. Back down. There. That way. Back down. Bend this knee. Good. Bend this knee. Can you spread? Put them back together. Awesome. Oh, let me see if there's any edema in your ankles. Do you ever have an issue with edema?
Not generally.
No, they both look good. That one looks good. Let me see this one. Yep. No edema. All right. 1 second. I'm going to get a couple things over here. All right. So earlier you told me your birthday. Can you tell me who was the president immediately prior to the president that we currently have?
Barack Obama.
Okay. And how many terms did he serve?
2.
Who was the president before him?
Bush.
Okay. Very good. And I gave you 4 words earlier to remember. Can you tell me what those 4 words were?
Blue tree, car, horse.
Blue tree, car, horse. Perfect. All right. So we're going to check range of motion real quick. Can you put your arms out to the side? Bring them back in. Behind your back like this. Reach up in the sky. Good. Reach down. Circles. Can you lean forward? There we go. Lean back. Did you feel any popping, cracking, anything hurting during any of that? I didn't hear anything. Okay, good. I'm going to feel your spine, make sure there's no curvature in it, okay?
Okay.
And you said you didn't have a history of scoliosis, so
No.
that's good. Good. All right. Now I want you to close your eyes and out of sharp, dull, and soft. I want you to tell me what you feel. Can you put your 1 foot at a time up here for me? Okay. What you got there?
Soft. Dull. Sharp.
Good. See, you're up.
Dull. Sharp. Soft.
Good. Okay. Can you take your fingers and touch them together for me? Like that. 1, 2, 3, 4, 5. Good. No problems there?
No.
Arms out to the side like this. Finger to your nose. Finger to your nose. Okay. Can you take the heel of each foot and run it down your shin of the opposing leg? Good. Hurt anywhere? Feel any problems?
No.
Okay. If you can give me good strong grip on both sides, awesome. Have you ever had your reflexes tested?
Yeah.
Okay. That's what we're going to do now. Let me see your arms. We'll do that. Okay, you ready?
Mhm.
Good. Good. And if you can cross your legs for me. Ready?
Mhm.
Good. Ready?
Mhm.
Good. We checked the range of motion in your neck a little bit earlier when I had you move it around. So I think that about covers anything. Do you have any questions or concerns or
No.
no problems at all?
No.
All right. Well, it was great meeting you, and I hope you have a good day. I'll have the doctor come right in.
Thank you.
Thank you.